speaker is Dr. Kevin Stillwagon. Dr. Stillwagon, if you'll state your name and address for the record, you'll have 3 minutes, sir. Thank you.
My name is Dr. Kevin Stillwagon. My address is 205 Dolphin Point, Clearwater Beach, Florida. I am a property owner and a taxpayer in Orange County. You are making some really bad decisions based on fear of a virus that has about a 99% survival rate for most of us. That is unsubstantiated fear. So let me give you a couple of things to truly be fearful about. That mask that you keep insisting that people wear decreases the amount of oxygen in your lung tissue. We now know that this virus uses something called a furin cleavage site to merge with your lung tissue to infect you. And it works better with decreased oxygen. And peer-reviewed research clearly shows that wearing a mask increases your chances of developing an upper respiratory infection 13 times more than a person not wearing a mask. So I would stop wearing a mask immediately if I were you. Secondly, this shot that you insist on people getting gives you absolutely no protection against infection. It is the innate immune system that protects you from infection by using dendritic cells, T cells, and natural killer cells without antibodies ever becoming involved. This shot has one goal, and that goal is to make antibodies. These antibodies circulate inside of you and cannot prevent an infection. They can only react to something that has already gotten inside of you. They cannot keep something out. The shot decreases the ability of your innate immune system to keep viruses out by 60%, and a booster shot will reduce it even more. Even worse, the antibodies that are created by this shot can no longer neutralize variants and actually enhance the virus' ability to infect you. It should be painfully obvious to you by now that fully vaccinated people are getting sick. And this will continue to get worse if you keep trying to jab people while a virus is trying to spread. The variants are emerging from the vaccinated population. This so-called vaccine is still being administered on what's called an emergency use authorization. It is not FDA approved. The FDA approved a biological licensing application for a product called Comirnaty. The application was approved, not the product. Comirnaty is not available in the United States. Therefore, by law, you cannot force people to take this drug without informed consent and without animal trials to prove that it is safe. Mayor Demings, please look at me. You, sir, are in violation of the United States Constitution and the Nuremberg Code. You will be held accountable. Good day.